I'm Dr. Sarpoma, MD, your board-certified family medicine physician, and I'm here today to talk with you about the science as it relates to high blood pressure. You see, the American Heart Association projects that there will be more than 100 million people in the United States alone that are living with high blood pressure, and that many of them don't even know they have it. Well, first off, if you think about the title, high blood pressure, what does it mean? It means exactly what it says, that there is an increased pressure, but in your blood vessels. These blood vessels are your veins, your arteries, and the exchange that happens in the capillaries. The problem with having high blood pressure is that blood does not get to our organs where they need the nutrients that are getting passed around in our blood vessels. These organs are our brain and our heart. But we have more organs than that, and all of these organs are affected whenever your blood pressure is high. If you can think about it, think of these two holes as blood vessels, and I'm going to just use my hands. And what happens when there's an increased pressure? The pipes in these can break, and that's what causes a hemorrhage. When it breaks, the hemorrhage usually happens in areas where there's a lot of blood vessels and a lot of flow. And this happens usually in the brain. So, on the contrary, what happens when our blood vessels are constricted or are kind of closed up like this? And why would they be closed up like this? Because there are things that are preventing the blood to flow. And it's usually things like plaques from fat, calcium, things that, from the wear and tear of your blood vessel. And so that will cause a blockage. Now, what happens when there's a blockage of flow to your heart? Something called a heart attack. And that's due usually to the fat deposits that are in the little blood vessels of your heart. So I don't know if you remember from science class, but molecules tend to move from a higher concentration to a lower concentration. In our body and in our blood vessel, the way that this usually happens is salt that we find in all of our food is usually an additive that we add, but wherever salt goes, water and fluid go together. And that is increasing the volume inside of your blood vessel. So it can do exactly what I said. Usually when there's an increased volume, if you think about it, it can explode. And that explosion is what causes the horrible complications of high blood pressure, which is the hemorrhagic stroke that I just talked about. If you also can think about this, in our blood vessels, we have valves that open and close. And this exactly helps for the blood to get pushed from our lower extremities, which are our legs, our ankles, and for it to reach to the top. A lot of people will complain of having swollen feet. You can get swollen feet and not necessarily have high blood pressure, but when you walk and when you exercise, these are things that can assist with this pump system from taking the blood out of these lower areas of our body into the top and to areas that we need it. So, what can you do to prevent high blood pressure? Number one, know your status. Get your blood pressure checked. After you get your blood pressure checked, please listen to the recommendations that have been given to you. And the biggest recommendation would be to decrease the salt in your diet and to maintain a healthy lifestyle, which includes diet and exercise. This is Dr. Sarpoma, MD, and remember, your health is your wealth. Thank you very much.